Have you ever wondered why you feel so tired, irritated, or unable to think clearly after missing just one night of sleep? Imagine what happens to your body and mind when this continues for days, weeks, or even months. That condition is called sleep deprivation, and today we are going to understand it in detail. In this video, we will discuss what sleep deprivation is, how it is different from insomnia, who it affects, what happens to your body when you are sleep deprived, which health problems it can lead to, and what symptoms you should look out for. Do not forget to subscribe to this channel and share this video so that more people can learn about health in simple language. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCPUK, medicine specialist, diabetes and hormone specialist. The information has been collected from trusted medical books and reliable websites like Cleveland Clinic, Mayo Clinic, and Patient Information. So let us begin. What is sleep deprivation? Sleep deprivation is when a person does not get enough sleep. Sometimes it may be short-term, like 1 or 2 nights of poor sleep. Sometimes it can be long-term, lasting for weeks or even months. Sleep deprivation can happen for many reasons. Sometimes it is because of lifestyle, like working late, using too much screen time, or stress. Sometimes it can be due to medical conditions such as sleep apnea, restless legs, depression, or pain. Now you may ask, how is this different from insomnia? Insomnia means you are trying to sleep, but you are not able to. Sleep deprivation means you are simply not giving yourself enough time to sleep, or you are sleeping, but the quality is so poor that you still wake up tired. Who does it affect? The truth is, sleep deprivation can affect anyone. Children, teenagers, adults, and older people. It is very common. In fact, experts say that almost 70 million adults in the United States alone meet the medical criteria for sleep deprivation at any given time. Almost every human being experiences it at some point in life. But why is sleep so important? To understand this, let us take a quick look at the sleep cycle. When you fall asleep, your body goes through different stages. Stage 1 is light sleep. It lasts only a few minutes. Stage 2 is deeper sleep. It makes up almost half of your total sleep and is important for memory and learning. Stage 3 is the deepest sleep. This is when your body repairs itself. It helps your muscles recover, your tissues heal, and your brain gets the rest it needs. Finally, there is REM sleep, which means rapid eye movement sleep. This is when dreams happen. REM sleep is also important for learning, emotions, and creativity. Most people need 7 to 9 hours of sleep every night, which usually means going through 4 to 5 full sleep cycles. When you do not get that, your body and mind start to suffer. So what happens inside the body when you are sleep deprived? Let us see. First, your heart and blood circulation system. Poor sleep puts extra strain on your heart. It increases the risk of high blood pressure, high cholesterol, heart attack, and stroke. Second, your metabolism. Sleep deprivation raises the risk of type 2 diabetes and obesity. It affects the way your body uses sugar and hormones. Third, your immune system. Your natural defense against infections becomes weak. You catch colds and flu more easily, and recovery also takes longer. Fourth, your brain and nervous system. Lack of sleep slows down your thinking, memory, focus, and reaction time. It also increases pain sensitivity. In fact, studies show that long-term sleep deprivation may even increase the risk of Alzheimer's disease. Fifth, your mental health. Sleep deprivation can make you feel irritable, anxious, depressed, and emotionally unstable. It can create a dangerous cycle where poor sleep worsens your mental health and poor mental health further disturbs your sleep. Now let us talk about the symptoms. In the beginning, you may notice mild problems like daytime sleepiness, fatigue, irritability, headaches, or trouble concentrating. But as sleep deprivation continues, the symptoms can become very severe. People may experience sudden moments of falling asleep, called microsleeps. They may have slurred speech, drooping eyelids, tremors in the hands, hallucinations, poor judgment, and even reckless behavior. In fact, staying awake for more than 24 hours affects the brain similar to being drunk with alcohol. There are also stages of total sleep deprivation. After 24 hours, you start losing focus and become unsafe to drive. After 2 days, microsleeps and poor thinking become very common. After 3 days, hallucinations may begin, and beyond that, the brain struggles to separate reality from imagination. What causes sleep deprivation? Sometimes it is lifestyle, such as shift work, late-night screen use, caffeine or alcohol in the evening, or high stress levels. Sometimes it is due to medical conditions like sleep apnea, restless legs, depression, anxiety, chronic pain, or neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease. How is it diagnosed? Often, a doctor can tell from your history and symptoms. Sometimes special tests are needed. These may include sleep apnea studies, brainwave tests called electroencephalogram, sleep cycle tracking with a device called actigraphy, or tests to measure how easily you fall asleep in the daytime. Now, the important question: why should you care? Because chronic sleep deprivation can increase the risk of many serious conditions. These include type 2 diabetes, high blood pressure, obesity, depression, stroke, heart attack, anxiety, and even psychosis. So, if you are not sleeping well, do not ignore it. Talk to your healthcare provider, look at your sleep habits, and take steps to improve your sleep hygiene. Go to bed and wake up at the same time every day. Avoid caffeine and alcohol in the evening. Keep your bedroom dark and quiet. And reduce screen use before bed. To summarize, sleep deprivation is not just about feeling tired. It affects your entire body, from your brain to your heart to your immune system. It can cause serious health problems if ignored. But the good news is, by improving lifestyle and seeking medical help when needed, you can protect your health and enjoy the powerful benefits of good sleep. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, United Kingdom, medicine specialist, diabetes and hormone specialist. The information has been collected from Cleveland Clinic, Mayo Clinic, and patient information. Do not forget to subscribe and share this channel so that more people can learn about their health in simple language.